here we go. So first we're talking about adductor brevis, adductor. It's giving us a indication of the motion, the action, and brevis is going to be the short one. So if we look at this diagram to our left right here, we can see the adductor brevis right here attaching onto the femur and onto the pelvis, specifically on the pubic bone. And we can see other adductors in there, the adductor magnus and adductor longus. So the origin of the adductor brevis is the inferior pubic ramus, and then when we insert onto the femur, but we're inserting onto the posterior aspect of the femur, onto a structure called the linea aspera. And so if we take a look here, this is the posterior view, we can see the linea aspera. Here's one right here. Here's another one right here. This is a female model. If we switch to a male model, right here, they're slightly more prominent. Right here, right there. So these are structures on the posterior side of the femur that allow some muscles to attach to them, just another prominence on the shaft of the femur, on the posterior side, on the shaft of the femur, that allow more of these adductors, more of these muscles that attach onto the femur, just something else to grab onto. So we insert onto we're inserting onto medial lip of linea aspera. This is in the middle third. Okay, and then our action, we have action, it's all at the hip joint, right? We're only crossing right here. We're only crossing the hip joint right here. So what we're going to end up having is a couple of different actions. We will have adduction and flexion. Right, because you have going from laterally to medially, we get that adduction. We get flexion because we're moving we have that insertion on that posterior aspect of the femur, and we're inserting onto the inferior pubic ramus, so there's a bit of anterior posterior movement, so we get that flexion, and that flexion is, we get flexion. We also get a bit of extension. And we have pelvic stabilization in the coronal and sagittal planes. So that's that anterior posterior plane. So we're splitting into right and left half and into front and back. All right. So now when we move to the adductor longus that was cut away in the last image. It is this structure right here. Same origin as our adductor brevis, relatively. So we have an origin on the superior pubic ramus, and the anterior side of the pubic symphysis. So we can see right here in this image, it doesn't exactly go over the entire pubic symphysis, but broadly what we will have is structures and tendons and other broad bands of tissue that will go over the pubic symphysis right here. It's not as clean in actual anatomical structures, actual anatomy, and so it'll just have that broad origination as a common tendinous insertion, much like when we talk about the common insertions onto the shoulder with the rotator cuff, where how it's kind of spread out over the greater and lesser tuberosities, and it covers the bicipital groove, and it has more of a broad insertion, where in actual anatomy, whereas in textbook anatomy, they're shown a little bit more cleaner onto one area specifically because they are artist renderings. So that's superior pubic ramus and anterior side of, let's get that F, pubic symphysis. All right. And so the adductor longus has essentially the same insertion when we look at it on this model here. So, hold on, so when we look at it on this model here, we can see, once again, we have that anterior line of pull. So we'll probably be doing a little bit of flexion, a little bit of adduction as well. That linea aspera. When we talk about the middle third, we're really talking about line to here to here. So really, when we're talking about the middle third, it's that shaft portion of the femur. So that medial linea aspera. It's going to be an insertion of the adductor longus right here. Once again, so that adductor longus versus that adductor brevis. Okay. And then let's see this on a female model. Just slightly different, right? There isn't as prominent a linea aspera, but we can still see it running right down here, okay? So exact same insertion. All right, middle 1/3 of the femur on the medial lip of the linea aspera. Okay, and then our action is going to be the exact same as the adductor brevis. So we have adduction, flexion, extension, and pelvic stabilization. Now, specifically with the flexion and extension, I know that might be confusing. So let me clarify for a moment here. The flexion is going to happen up to about 70 degrees of flexion. So when we start in anatomical position, moving up to 70 degrees of flexion. Past that, it's going to be more so, we're going to have more assistance from our quad and some more of those anterior muscles on our hip to allow us to fully flex. So that iliacus, psoas major, our quad, our rectus femoris, a lot of those muscles are going to allow us to do additional flexion past 70 degrees. And so then once we're in that flex state, the adductor brevis and adductor longus can help us extend after we're in that flex state, go into extension, because once we get past that point of 70 degrees of flexion, the hamstrings, which are typically responsible for hip extension, are relatively thin and sometimes need some help. And so I'm going to draw a circle right here. So the flexion, we'll call, so 90 is here, so probably about here. So we'll call that 70 degrees. That looks more like 45. So this is 90, so we'll jump, boom. Let's say it's about there. All right, so that's about 70 degrees of flexion, right? So up to, we'll use a blue line right here. So on this graph, from here to here, we're having that flexion. And then once we get just a little bit farther, if we're trying to move posteriorly, let's choose a different color. We're trying to move posteriorly, that extension, that adductor brevis and adductor longus are going to help us once we're in that flexed state. Okay. Now moving to the soleus. Soleus is sometimes the soleus and gastrocnemius are referred to as one big muscle, as the triceps surae. However, we are going to refer to it as the soleus because it makes it easier to understand. So the soleus has a couple of originations. So it originates on the tibia and fibula, but we will start on the fibula. It originates on the posterior surface of the head and neck of the fibula. Okay, that fibula, important part. And then on the tibia, it originates on the soleal line. So there's tibia. So when we look at our model here, and if you pick up a tibia in class, you can partially see that soleal line. And so here's our soleus right here, and we can see proximally it's originating on that neck and head of the fibula. And then there's this kind of soleal line right here. So let's see if we can. So if we hide this right here, we can see that soleal line right there, this diagonal line on the posterior side of the fibula. What in the world? Right? So now if we unhide it here, we can see that origination on that diagonal path, on that proximal, on our proximal lower leg, or on our leg, excuse me. So if we're going back here, so then we insert, this should be something familiar to you. So we insert onto the calcaneal tuberosity. So we see down here, our calcaneus, we see our Achilles tendon right here. So we see our Achilles tendon right here, and we're inserting onto the calcaneus. Here's our soleus right here. Soleus is the deeper of the calf muscles. So here, hold on. I'm getting ahead of myself. So, So the soleus is the deeper of the two calf muscles. You can feel it typically more so on the medial side, just posterior to your tibia, just off that medial tibial crest. So it's right there. And its action is going to be plantar flexion. We will see the gastroc, or our more superficial calf muscle, crosses two joints, so it'll have actions at both the knee joint and at the ankle joint. But the soleus only crosses the ankle joint or the talocrural joint, and so it only has that action at the ankle joint right there. So our gastroc. So we have two heads of the gastroc. And so we're going to start, they both originate, on the femur. So the medial head originates on the superior posterior part of the medial femoral condyle. Superior part of So that medial head is going to be right there. So let's highlight where that origin is going to be, right over there. And then the lateral head, you can't see it great here, but we can see kind of a little bit better in this picture, that gastroc medial head, that origin right there for the medial head. And then the lateral head is a little bit lower on the femoral condyles, on that lateral femoral condyle. And anatomists have described it as just the lateral surface of the lateral femoral condyle. So then we have our second origin right over here. And here is our gastroc muscle right here. Okay. So then, much like the soleus, same insertion. It inserts onto the calcaneal tuberosity via the Achilles tendon. And remember now, we cross both the knee joint and the ankle joint, so we're going to have two actions. So at the ankle joint, we are going to have plantar flexion when the knee is extended. So we'll just simplify that to plantar flexion of the ankle. Plantar flexion. And then we have, at the knee joint, we have some flexion, right? Remember, we're on the posterior side, and so the only way that we can move the knee joint is into flexion. Okay? Those are your first four muscles. If you have any questions, please shoot me an email, and I will try to get back to you as soon as I can.